Okay, so now we're gonna go through a treatment technique called sustained soft tissue mobilization. It's a treatment technique specifically to help loosen posterior capsule in the glenohumeral joint for patients with limited internal rotation of the shoulder. And as we do it, I'll kind of go through what's happening at the posterior capsule when we do this. So in order to get the posterior capsule on stretch, if with a patient that's got limited internal rotation, we're going to have to internally rotate the shoulder in order to stretch that posterior capsule. And so, depending on how much range, obviously Annie has plenty of internal rotation here. Some patients, when they may get to the point eventually where you will be doing sustained soft tissue mobilization to get the last few degrees, maybe the last 10 degrees of internal rotation. But most of the time, once you get that really stiff shoulder up to 90 degrees or very close to 90 degrees of abduction, once you've achieved that and you've got some semblance of internal rotation, then you can apply sustained soft tissue mobilization in order to try and gain more range of motion. So what we'll do is we're going to take a roll towel and place it right under coracoid, so that you're in just medial to the joint line, just medial to the glenohumeral joint line. And then, in order to try and make this more comfortable for the patient, we're going to try and get elbow and glenohumeral joint as close to the same plane as possible. So in this case, I'm just using, you could use another towel if you wanted to. In this case, I'm just using the face hole block that we took out in order to make the patient more comfortable. So this is the general position. If you want to get enough internal rotation so that you can actually see the inferior angle of the scapula start to rise a little bit, because you're taking up all the slack that's available in that posterior capsule. And then what we'll do is we're going to take a little bit of a pad here, and you can either, since this is her left arm, I'm going to be taking my left hand. You can either use the flat palm of your left hand to press the scapula back down onto the ribs, and then use that same elbow in order to make sure that you block any loss of internal rotation. So the patient then is maximally stretched into internal rotation. Once you've done that, and that may be and should be a little bit uncomfortable for the patient, then, and please communicate this very clearly with the patient, that this should be a little bit uncomfortable, and then the comfort level should increase and it should become much more comfortable as soon as you start to press anteriorly along the joint line. Now this looks like it would be an anterior glide, which it is, anterior glide of the humeral head. However, since you have the posterior capsule on maximum stretch, pushing the humeral head anteriorly is going to further stretch that posterior capsule. So this is really a posterior capsular stretch. And you want to hold that position, and it should be comfortable to the patient. Is that comfortable, Annie? So it should be comfortable to the patient. Make sure it is. Make sure that they know that if it's not comfortable, to let you know, because then you can adjust the technique so that it is comfortable. And if you just hold that position, maintain the stretch on the tissue. You don't have to do anything extra. Just maintain the stretch within 60 to 90 seconds. Even in some of the most stubborn posterior capsules, you're going to start to get a little bit of stretch in that capsule. And you may feel it start to go a little bit. You may feel it start to kind of lengthen a little bit. And so you hold for that full, a minimum of 60 seconds. If you can hold 90 seconds or longer, that's great. The main thing I would caution you about as far as body mechanics goes, try to minimize the amount of twist in your lumbar spine, and so that you're comfortable and you're not straining your own lumbar spine. And then the other thing is that if you have difficulty maintaining the pressure on your own wrist against their scapula, you can do it with a flat fist right into the side of the scapula. But definitely pad it so it's more comfortable for the patient. And if you don't have foam, you can use towel, folded towel, and do the same thing. So you're pressing the scapula towards the rib cage, making sure that that towel is at slightly medial to the joint line, pressing the scapula towards the rib cage, maintaining internal rotation with your elbow on the same hand, and then press right along posterior edge of the humerus, along, try to stay in the plane of the joint line if possible, and just press anteriorly. Try to hold for 60 to 90 seconds.
Bye now.
Okay, thank you.